Hey, it's Shane with GotRom.com. This video is about should you stretch your back if you're having low back pain? And actually, the answer to that question is not should you stretch your back, it's how are you stretching your back? One way is incorrect and one way can be helpful. And also, do you have a comprehensive plan for fixing your low back? Because just stretching it is not going to cut it. So, let me show you a couple exercises. So let's say that you're lifting weights in the gym, everything's going just fine one day, but then all of a sudden, bam, something happens. Or maybe it wasn't in the gym, maybe you were just sleeping funny and something happened to your low back. The first thing that people intuitively do is bend over to stretch it, or maybe they get on the ground and do some kind of twisting stretch. But one of the world's foremost experts in back pain, Dr. Stuart McGill, who is a leading researcher in this field and is also the author of quite a few really excellent books on back pain, says that what the spine needs is not necessarily just a stretch. It's not a twist or a flexion stretch. Likely it's core stability. And when we're talking about your core, we're talking about not just your abs, but also your hips, your low back, the center of your body. So you need core stability and hip mobility, which those two things, core stability and hip mobility, can look like some simple exercises or some more advanced exercises to develop both the mobility and the stability. And these are obviously pictures of the ultimate expression of hip mobility. But then you integrate that stability and mobility into your daily movements in the gym or in your normal life. But what Stu really brought to the fore is the concept of neutral spine while lifting things. So that means a nice flat back, maintaining the curves of your back. And the take-home message from Stu is basically stay neutral when you're rehabbing or lifting, avoid end ranges of flexion, extension, etc., rotation under load or for multiple reps, so no more 10,000 crunches a day, and then work on that core stability and hip mobility, which is going to help preserve and bulletproof your spine. So even though neutral spine is a huge important concept, there's also kind of a myth, the pendulum swings too far in one direction, and people think you can never be out of neutral spine. But what happens if you squat and your back just kind of naturally rounds, or you do a pistol squat, or something more advanced like a back bridge, which is a lot of lumbar extension potentially, ideally it's in the thoracic spine, or you throw a baseball, or you roll, or you tumble, or all kinds of sporting activities. The point is that avoid end ranges of these flexions and extensions and rotations when loaded or for thousands of repetitions. So you don't want to deadlift with a rounded back. You don't want to do a million crunches and not do something to counteract all those flexion moments on the spine. Also, a good thing to know is that one person's end range, we're trying to avoid these end ranges, but one person's end range might not look like someone else's. For example, someone with good hamstring flexibility and good motor control can go into a position that looks dangerous on the spine but isn't. For example, this is a advanced flexibility position. It's called a Jefferson curl, and I was doing it with 135 pounds, which is safe for me, but that's because I have good hip flexibility, good spinal awareness, and good motor control, something I've developed for many years. Someone who doesn't have that probably shouldn't do that exercise, especially not with that amount of weight, because bad things will happen. So, knowing that the spine can move in all directions, but neutral spine is the safest when you're rehabbing, especially when combined with core stability and hip mobility. What if your back's just tight and you just need a quick stretch, which is what this video is all about? The answer is you can stretch a back if it's tight, but here's what you shouldn't do. So let's say you have a tight back. Most people intuitively just kind of lean forward and feel a stretch on that low back. It's not so great. Or possibly they're in a yoga class or something, tight back, and they do some kind of a forward fold, really stretch that back out. No, tampoco. That means no, not good. So why do people intuitively stretch like this? Basically, in the moment, it feels good. It takes some tension out of the low back muscles and activates some muscle spindles and provides a good feeling of relief. But, as Dr. McGill points out, this is a poor long-term strategy. These end range flexion moments, flexion stretches overload the discs and can kind of keep you in pain in the long run, even if they temporarily relieve something. But what about if you're having pain and you look on the internet and YouTube tells you, do the Mckenzie press up, which can or can't be helpful. It depends on what's going on. Sometimes there's a bulging disc, and that position of a lot of lumbar extension can be helpful. These Mckenzie press-ups, sometimes called floppy push-ups because that's what they look like, are effective for some types of disc bulges or sciatica, but repeated end range extension is just a temporary strategy. It's not a life strategy that you can use anytime the back is in pain. And I covered this topic quite in depth in my sciatica solution program, as well as talk about all these concepts in my athlete's back 45-day program. So the answer is, how can I stretch my low back? Shane, you've been telling me I can do it, so how can I actually do it? So taking all these other things into consideration, if you do want to stretch your back, you can sit in this position. This is borrowed from yoga, and we're going to kind of side bend after we lengthen our spine. And this is a nice QL, quadratus lumborum stretch. I'm not trying to go super deep in it. It's just very gentle to kind of tell some of these spasmed muscles to chill out. And that can be a pretty good stretch. Another one is if that back is hurting, I can sit on an elevated surface, a pillow, a cushion, a foam roller, and get into sort of a meditation-like posture to lengthen my spine and then side bend. Notice my elbow position and my hand position. Those actually make a huge difference. If I want to do a modified version of this, I also can reach my arm long and get a little bit more of the whole fascial train. But I'm not just crunching my spine. First, you have to inhale and lengthen, and then exhale and kind of bend to the side like you're bending over a big beach ball. That is a good way to stretch the low back. So will this fix all your back pain? No, it's just one part of an overall solution. You also need to think about the rest of the spine, what's happening at your thoracic spine, what's going on at the lumbar region, how's the tissue quality in there, how's your spinal awareness. You might need to learn how to move better, how to stretch better, how to release some tightened muscles in the hamstrings and hip flexors, how to adjust your posture when you're sitting, how to develop that core stability that we talked about, and then how do you integrate all of that into your day-to-day activities in the gym or in life. Most people need to learn how to pick things up. How to do all of this is pretty complex, but fortunately, that's what we do.